back. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thank you so much for joining us. We are here now in the studio with Patrick Herson, who is president of Fairview Medical Group, and he provides physician administrative leadership for all strategic and operational aspects of Fairview. Thank you so much for joining us.
So happy to be here, Mabel.
What has the journey been like against the backdrop of the changes on the healthcare landscape?
Well, in Fairview, we are in Minnesota, and we have a really great statewide collaborative called Minnesota Community Measurement, which for about 10 years now has been publicly reporting quality at a group basis. And so we've been able to do a lot of benchmarking with ourselves and with our competitors and other people in our ecosystem, which has really been great. And even that by itself has driven quite a bit of improvement among folks. I can remember, for example, going back 8-9 years when our care for our diabetics, our optimal diabetes scores, were in the single digits. And I was at a health plan at that time at Blue Cross, and we were suggesting, what will it take to get to double digits? And people saying, oh my God, that felt impossible to do. And now actually my group last year, we were in the low 50% optimal control of our diabetics. So it's been a remarkable journey, and it's been incredibly valuable having the benchmarking data available, having better access to science about quality improvement science. That's made a big difference as well.
Well, they do say you have to know where you've been to know where you're going, right? So you've done that at Fairview.
Absolutely, and we've set some audacious goals for ourselves, which has been pretty inspiring for our frontline teams and our providers to step into the work. And our goals actually are to be the top decile for 12 of 19 primary care measures, the ones that we think impact the most patients and seem the most clinically relevant. And so that's really inspired people to step into the work. And having Epic, we've been longtime Epic users, has helped quite a bit too. It gives us access to where we have gaps in care, so we can really focus on those at the point of care. We've developed some mechanisms to reach out to patients between visits, so that we're not, as one of my patients said to us recently, it's like you're thinking about me even when I'm not here. And in fact, that was a nice way to frame it, that we are looking for opportunities to help people outside of their traditional appointments.
When it came to the diabetes situation, what were the initiatives that Fairview really led to get those numbers changed and improved?
Well, you know, part of it was to really step back. The diabetes overall is a roll-up of 5 measures. So we had to step back and see where on the 5 were we having the most trouble or difficulty. And there were a couple that stood out. There are a few of them that are easier to achieve, and there were a couple that stood out. One was smoking cessation. And so we really began to identify diabetics who were smokers, and that's not good. It's never good for anybody, but it's not good for diabetics because of the risk of heart disease or strokes. And we began to employ using our pharmacists to help us with them, to identify patients who might do well with Chantix or other medications or nicotine replacement therapy. So we began to use other parts of the care team to sort of take another run at some patients who the doctors felt like, I've been mentioning they're smoking for 20 years and they haven't done anything. So let's stop doing the same thing over and over and expecting a different result. Let's think about using other members on our care team, see what they can do.
So what are the incentives that have really worked at Fairview, not just with diabetes, but for other medical conditions that you've dealt with?
So we tried some big financial incentives about 5 or 6 years ago, and those actually didn't move the quality number as much as you would have thought. It was pretty interesting about that. It helped in some of our more rural communities, that it helped where people were starting from a lower quality point, but it didn't really help accelerate in our better performing clinics, which is kind of paradoxical in a way. Some of the incentives that have made a difference, though, we still have a small part in compensation based on quality. We've tried to be artful and find a blend of your individual performance as a doctor as well as how your clinic is performing. Try to take advantage of a little bit of social pressure. And that helps somewhat. But one of the biggest things has been establishing bold goals and really enrolling people in that, and then properly supporting it from an infrastructure perspective. So how we can bring project managers or additional staff that can help support that between visit care work and the like. And then also the I lost my train of thought, which is why I'm glad we're not live streaming.
Yeah.
But also, it's publicly available to anyone within our medical group can go in and look on our database to see how we're doing as a group, to see how our geographic region is doing, to see how our particular clinic is doing, down to the individual providers to see how they're performing.
What are some challenges on the horizon that you're very concerned about?
I'd say the things that, just not in quality, but the things that I worry about a lot is this whole provider burnout epidemic that people are talking about, and how do we keep providers engaged. You probably know this, but across the country there are about 400 physicians who commit suicide every year. And that's about the equivalent of 2 graduating medical school classes every year. And so fortunately we haven't had any suicides in my group. But we've got a lot of work to do to make the systems work to prevent people from getting burned out and having the right resources when they do start to feel like they're getting burned out. We're making some progress in this, but a long way to go. I also worry that the rules seem to change so much, and not so much at where I work, but just from the payers, what they're interested in thinking about from a quality perspective, to government people, that it can feel if you don't have a steady hand on the helm or a true north for yourselves, you can run all over the place and never really make an impact on improving care, but chasing after numbers.
Yes. Well, we certainly appreciate the opportunity to speak with you at this particular meeting. Why was it important for you to come to the World Healthcare Congress?
Well, I was really attracted by the breadth of the different tracks that are happening. Often you see just one track, and then you don't get that cross-fertilization. People in nursing leadership, or people in payer leadership, and then the hospital health system side that I'm a part of. So that cross-fertilization is really important. And then I was attracted to the people who are on my panel later this afternoon. I'm looking forward to having a dialogue with them and a conversation about what they've tried and what's worked, and share the experiences that I've had at Fairview.
All right. Well, thank you so much for your time today. We really appreciate your comments.
You're welcome, Mabel. Thank you.
And thank you for watching. Stay tuned. Much more to come.